मैं अमिताभ बच्चन आज आपके सामने वो कहने जा रहा हूं जो मैंने पहले कभी नहीं कहा। मैं एक रोगी हूं, हेपेटाइटिस बी का रोगी। 1982 में कुली फिल्म की शूटिंग के दौरान मेरे साथ एक दुर्घटना हुई। ऑपरेशन करवाना पड़ा और मेरे शरीर में 60 बोतल खून चढ़ाया गया। खून का कोई एक सैंपल हेपेटाइटिस बी इन्फेक्टेड था जो मेरे लिवर तक पहुंच गया। कई सालों बाद आम जांच के दौरान जब इसका पता चला तो मुझे यह भी पता चला कि मेरा 1/4 लिवर ही बचा हुआ है। लेकिन सही इलाज के बाद आज मैं आपके सामने खड़ा हूं और काम कर रहा हूं। हेपेटाइटिस बी से बचने का पहला उपाय है शिशु के जन्म पर पहला टीका लगवाएं और पहले साल में 3 और नियमित टीके लगवाएं। ये आपका पहला कदम होना चाहिए। मुफ्त टीकाकरण के लिए अपने पास के स्वास्थ्य केंद्र जाएं और पूरी जानकारी लें। देखिए, ये जो हेपेटाइटिस बी है, इससे हम डरेंगे नहीं, लड़ेंगे। मैं हेपेटाइटिस बी का रोगी हूं और पिछले 20 साल से लगातार इसका इलाज करवा रहा हूं। पर आज मैं आपको पूरे विश्वास के साथ बताना चाहता हूं कि हेपेटाइटिस बी किसी को छूने या किसी के साथ उठने बैठने से नहीं होता। मैं अपने पूरे परिवार के साथ रहता हूं, नाती पोते के साथ खेलता हूं, सैकड़ों लोगों के साथ मिलता जुलता हूं। मेरे आम जीवन को इससे कोई फर्क नहीं पड़ा है और ना ही मेरे परिवारजनों को। लेकिन मुझे पता चला है कि हेपेटाइटिस बी के रोगियों के साथ लोग बहुत अन्याय करते हैं। उन्हें काम नहीं देते, बहू बेटियों को घर से निकाल देते हैं, उनके साथ बुरा व्यवहार करते हैं। देखिए, हेपेटाइटिस बी के रोगी को चाहिए इलाज और चाहिए परिवार और समाज का साथ। आप साथ दीजिए, ये मेरी आपसे विनती है। अधिक जानकारी के लिए आप अपने पास के स्वास्थ्य केंद्र में जा सकते हैं। हेपेटाइटिस बी, इससे डरेंगे नहीं, हम लड़ेंगे।
This is a healthy human liver. This vital organ is the chemical factory of our body. It performs over 500 tasks daily. How? First, detoxification and filtration. The liver acts as the body's primary filter, removing toxins, waste products, drugs, and other harmful substances from the blood. These are then converted into forms that can be excreted from the body through urine or feces. Second is bile production. The liver produces bile, a fluid critical for digestion. Bile helps break down and absorb fats, cholesterol, and fat-soluble vitamins like A, D, E, K in the small intestine. By emulsification of dietary fats, thousands of tiny butter droplets created with more surface area. It facilitates pancreatic lipase activity. As a result, micelles are formed. Once the micelles reach the brush border of the enterocytes, the monoglycerides and fatty acids diffuse out of the micelles and are absorbed into the intestinal cells. Third, metabolism of nutrients. The liver plays a central role in metabolizing carbohydrates, fats, and proteins. It converts excess glucose into glycogen for storage and releases glucose back into the bloodstream when needed to maintain stable blood sugar levels. It can also create glucose from other sources, that is, gluconeogenetic pathway. It breaks down fats, synthesizes cholesterol, and produces special proteins to transport fats throughout the body. It regulates blood levels of amino acids, the building blocks of proteins, and produces many essential proteins for blood plasma, including albumin and clotting factors. The liver stores important vitamins like A, D, E, K, B12, minerals like iron, copper, and glycogen too, ensuring the body has reserves when needed. Blood clotting. It produces proteins necessary for blood clotting, which are vital for stopping bleeding after an injury. Liver plays a great role in immune function. The liver is an important part of the immune system. It contains specialized immune cells, that is Kupffer cells, which can remove bacteria, viruses, and other foreign particles from the bloodstream, helping to fight infections. Liver plays role in hemoglobin formation. Now the question is, why hepatitis occur? Hepatitis is a serious health issue worldwide. It is affecting people of all ages nowadays. If left untreated, it became fatal. Hepatitis is an inflammation of liver that can be caused by various factors, including viral infections, excessive alcohol consumption, toxins, certain medications, blood transfusion, and autoimmune disorders. When liver is inflamed, it can't function properly. On the basis of infection, viral hepatitis mainly are of 5 types. They are hepatitis A, B, C, D, and E. On the basis of condition, hepatitis are of 2 types: chronic and acute hepatitis. Chronic is a long-term infection. Liver inflammation and damage is the result. Progression of the disease can cause liver cirrhosis, liver failure, even liver cancer. Acute hepatitis is a short-term infection. Body can remove the hepatitis virus by its own. Mild symptoms occur, like B, C, and D.
Viral hepatitis is a condition that affects your liver. They can also affect your body in different ways. It is important to learn about each one. Hepatitis A is one type of this liver illness. It usually spreads when someone ingests the virus. This can happen from close contact with an infected person. It can also happen by eating contaminated food or drinking contaminated water. This is often called the fecal-oral route. This means the virus from the stool of an infected person somehow gets into the mouth of another person. This might sound unpleasant, but it is why hand washing is so incredibly important, especially after using the bathroom and before preparing or eating food. This simple act can stop the virus from spreading to others in your home or community. The time between getting the virus and feeling sick is called the incubation period. For hepatitis A, this is usually about 2 to 4 weeks, but it can be longer. When symptoms do appear, they can include feeling very tired. You might also experience nausea, which is feeling like you might vomit. Some people have pain in their stomach area. A common sign is jaundice. This is when your skin and the whites of your eyes turn yellow. Your urine might also become dark, and your stools might be pale. The good news about hepatitis A is that it is usually an acute or short-term infection. Like water helps your body fight the infection. Eating healthy foods gives your body energy. It is also very important to avoid alcohol because it can put more stress on your already inflamed liver. Hepatitis B is transmitted through contact with infected blood. It can also spread through semen and other body fluids from an infected person. This means it can be passed from an infected mother to her baby during childbirth. Sharing needles for drug use is a major risk factor. Having unprotected sex with an infected person can also spread the virus. Even sharing personal items like razors or toothbrushes that might have tiny amounts of blood on them can be a risk if someone in the house is infected. When someone first gets hepatitis B, it is called an acute infection. Many people with acute hepatitis B might not have any symptoms. If they do, the symptoms are similar to hepatitis A. These can include fatigue, fever, loss of appetite, nausea, and vomiting. Abdominal pain, dark urine, pale stools, joint pain, and jaundice can also occur. These symptoms usually appear about 1 to 4 months after exposure to the virus. Most adults with a healthy immune system will recover fully from acute hepatitis B within a few months. Many people with chronic hepatitis B do not feel sick for many years, but the virus is still silently damaging their liver. Over time, chronic hepatitis B can lead to serious liver problems. These include cirrhosis, which is scarring of the liver. It can also lead to liver failure, where the liver stops working properly. The risk of developing liver cancer is also significantly increased with chronic hepatitis B. This makes early detection so important. The best way to protect yourself and others from hepatitis B is through vaccination. Recommended for all infants at birth and for children and adolescents who were not vaccinated earlier. Adults, especially those at higher risk, should also get vaccinated. For those who develop chronic hepatitis B, there are antiviral medications. These medicines can help control the virus. They can reduce the risk of liver damage and cancer. Regular monitoring by a doctor is essential for people with chronic hepatitis B. Hepatitis C is caused by the hepatitis C virus or HCV. This virus primarily spreads through blood-to-blood contact. The most common way people get hepatitis C today is by sharing needles or other equipment used to prepare and inject drugs, through blood transfusions and organ transplants. Now that risk is very low in countries with good screening. It can also spread, though less commonly through sexual contact, from an infected mother to her baby during childbirth, or by sharing personal items. To 85% of people who get hepatitis C, the infection will become long-term. Like chronic hepatitis B, chronic hepatitis C can lead to serious liver problems over many years if it is not treated. Unlike hepatitis A and B, there is currently no vaccine to prevent hepatitis C. It means being cautious about tattoos and piercings, ensuring they are done with sterile equipment. Hepatitis D, also known as the Delta virus, is a unique type of hepatitis. It is unique because it can only infect people who are already infected with hepatitis B. You cannot get hepatitis D on its own. It needs the hepatitis B virus to be able to multiply in your body. It can make the liver disease more severe and progress faster than hepatitis B alone. Hepatitis E is more common in parts of the world with poor sanitation and unsafe water supplies. Most people who get hepatitis E experience an acute or short-term illness. Symptoms are similar to hepatitis A. It's wise to avoid drinking too much alcohol. Alcohol can damage your liver, and if your liver is already inflamed from hepatitis, alcohol can make it much worse. Eating a balanced, nutritious diet helps your liver function well. Understanding non-viral hepatitis. Some forms are linked to lifestyle choices. Others might be due to underlying metabolic disorders that affect how the body processes certain substances. Sometimes medications intended to heal can inadvertently harm the liver. Even the body's own defense system can mistakenly attack liver cells. Identifying the exact type of non-viral hepatitis is key. For instance, advancing age can sometimes make the liver more vulnerable to damage. Certain genetic predispositions can also play a significant role in some types of liver conditions. We also see that gender can be a factor. For example, autoimmune hepatitis is more commonly diagnosed in women. Understanding these influencing factors helps us to identify individuals who might be at higher risk. This knowledge can guide preventive strategies and promote earlier detection of liver problems. Alcoholic hepatitis is a serious condition directly caused by excessive alcohol consumption. When a person drinks too much alcohol over a prolonged period, the liver works very hard to process it. This process can create harmful byproducts that damage liver cells. Autoimmune hepatitis is a chronic condition where the body's own immune system mistakenly attacks healthy liver cells.
Hepatitis C can indirectly but significantly affect the brain as hepatic encephalopathy when the liver is damaged and unable to filter toxins from the blood effectively. Toxin build up and reach the brain. It disrupts normal brain function, leading to a spectrum of neurological and psychiatric symptoms. Guillain-Barré syndrome or GBS, neurologic amyotrophy, encephalitis and meningoencephalitis, Bell's palsy, etc. Gastrointestinal bleeding or electrolyte imbalances in the body is also reported. Chronic infection by hepatitis C virus affects the lung. Interstitial pneumonitis and pulmonary fibrosis, COPD, and asthma. Infection are mostly asymptomatic and progressive. Indirect effects comprise port pulmonary hypertension, mixed cryoglobulinemia, emphysema, autoimmune thyroid disease, and myositis. Routine screening with pulmonary function tests would be beneficial for these patients. Hepatitis B increased atherosclerosis risk, potential for heart failure and cardiomyopathy, and impacts on ventricular function. Report shows there is a link between paternal hepatitis B infection and congenital heart defects in offspring. Hepatitis C accelerates CKD progression. It increases the risk of developing diabetes, which is a major cause of CKD. HCV enhances the mortality rate of kidney patients. Chance of infection is higher in hemodialysis patients. serologic assays that detect antibodies to HCV, and molecular assays that detect or quantify HCV and other detection tests. Direct-acting antiviral agents have revolutionized HCV treatment, also improves CKD outcomes. HBV infection shows significant effects on kidney, especially in adult population in past few decades. Developing glomerulonephritis, polyarteritis nodosa, membranoproliferative glomerulonephritis are the effects. The virus may also directly infect kidney cells, contributing to renal injury. Fertility and pregnancy outcomes are affected in both men and women respectively by hepatitis B. Chronic infection of this virus can affect sperm quality and motility in men and increase tubal infertility and lower implantation rate in females. HPV vaccination is the only protection available.
Hepatitis, ladies and gentlemen, is a disease which kills. Nearly 3,000 people die every day from hepatitis B and C. 3,000 lives lost to hepatitis B and C every day. This is quite alarming. For those that are unaware, hepatitis leads to disability. It continues to cause untold misery, and this despite hepatitis being preventable. For a person living with hepatitis, every day is Hepatitis Day. On a personal note, as one who suffers from this dreaded disease, due unfortunately to an undetected blood transfusion, I can feel the pain of a sufferer and the pain of my near and dear ones. All of us collectively need to ask, what will it take to prevent more people from losing their lives, their family members, and their health to hepatitis? It is important, therefore, for all of you to know that simple preventive measures are indeed available and that they are available free of cost. Let me enumerate them to you. 1. Birth dose. Every child born in any part of the world should get the precious gift of the hepatitis birth dose. Number 2, safe injections. Ensure that injections are a one-time use and then disposed of. Lives are more precious than injections. The third, take injections only if needed. Do not pressurize your doctor to give you injections only because it makes you feel that you've been treated. Number 4, safe blood transfusion, and we've just spoken about that. Number 5, safe dental procedures. Like prevention, a timely detection is most important. Do you know that only 10% people with hepatitis today know their status? The balance 90% are unaware that they're inflicted with this disease. Get tested. Get treated. Hepatitis can be treated by doctors using standard, simple protocols. You don't always need a specialist. Medical institutions need to train doctors to treat hepatitis. Trained doctors need to be available in district, sub-district, and village levels. You know, today India has one of the world's cheapest treatment of the deadly hepatitis C. We must make this treatment available to all. I feel very proud to say that India is the only country in the WHO Southeast Asia region that has a full hepatitis program benefiting hundreds of people. The world, ladies and gentlemen, is committing to eliminating hepatitis as a public health problem by the year 2030. WHO Southeast Asia region, under the leadership of Dr. Poonam Khetrapal Singh, has been making rapid strides towards this very noble and worthy cause, and we compliment her on this. Do you know that countries such as Bangladesh, Bhutan, Nepal, and Thailand have achieved hepatitis B control with remarkable results? The prevalence of the deadly disease has dropped to less than 1% among 5-year-old children. But we need to do more. Action to eliminate viral hepatitis cannot and must not wait. We must collectively resolve, communicate, and act. And lastly, may I just say that for everyone to get treatment without catastrophic costs, it is of utmost importance that we bring care closer to communities. Care closer to communities, to where they live. Thank you so much. Dhanyavad. Namaskar.
is public awareness about a critical but often overlooked health issue, hepatitis. Hepatitis is the inflammation of the liver and it can be caused by viruses, unsafe medical practices, poor hygiene, or even lifestyle choices. What makes it especially dangerous is that many cases go undiagnosed due to lack of symptoms or awareness, putting people at risk of long-term liver damage. Our world chart provides a clear overview of the types of hepatitis, modes of transmission, preventive measures, and the importance of early diagnosis and vaccination. Through this, we hope to spread knowledge that empowers everyone to protect their health and encourage others to do the same. Thank you for your attention, and we invite you to take a closer look at the chart. People of all ages now, if left untreated, can become fatal. One must know about it to understand the root causes and transmission methods to prevent hepatitis, which can manage the condition effectively. So the question is, what is hepatitis? Hepatitis is an inflammation of the liver that can be caused by various factors, including viral infection, excessive alcohol consumption, toxins, certain medication, blood transfusion, and autoimmune disorders. When liver is inflamed, it cannot function properly. And what are the types of hepatitis? On the basis of condition, hepatitis are of two types: chronic hepatitis and acute hepatitis. On the basis of infection, hepatitis are of five types. They are hepatitis A, B, C, D, and E. Agni and Debjani will elaborate further on this topic later. According to WHO report on viral hepatitis epidemiology, mainly people who are living with low and middle income comprises 80% of viral hepatitis infection and death. 40 million people are chronically infected with hepatitis B, and 12 million people are chronically infected with hepatitis C. Hepatitis E virus is the most important cause of epidemic hepatitis, though hepatitis A virus is more common among children. Hepatitis B virus is the most common cause of chronic hepatitis and hepatocellular carcinoma in the world. Almost 20,000 new acute infections occur every year. India has reported over 2,700 deaths due to hepatitis B in the last 5 years. In 2024, as many as 607 deaths were reported. The highest number of deaths, 124, were from Maharashtra, following Gujarat 95, West Bengal 80, Uttar Pradesh 79, and in Madhya Pradesh 72. In 2018, National Viral Hepatitis Control Program was running under the National Health Mission to offer diagnostics and treatment services for hepatitis C, A, and E. In hepatitis B hotspots of India, the people with rural background are most vulnerable because of unsafe legal and injection practices and due to non-availability of proper healthcare facilities. West Bengal has a high prevalence of hepatitis B, 1.26% compared to the national average, which is 0.95%. Hepatitis B and C infections are notifiable disease in the state, with health officials encouraging early detection and intervention. The state has 36 treatment centers for viral hepatitis. Unsafe injection practices, particularly by unqualified medical practitioners, are a major concern for hepatitis B transmission. The Clinical Health Access Initiative is implementing a program to eliminate HIV, syphilis, and hepatitis B in the state. Thank you.
How to detect hepatitis? To detect hepatitis B or other related infections, doctors are use several tests. This includes a blood test and antibody detection test. Some important markers they also use. These are hepatitis B surface antigen and hepatitis B surface antibody and hepatitis B core antibody. They may also use a special test called a NAT. This is nucleic amplification test to look for the virus's genetic materials. Other helpful tests includes the hepatitis A IgM antibody test and hepatitis C virus antibody test. In some cases, a liver biopsy or liver ultrasound may also be done for more information.
Hepatitis types. On the basis of condition, hepatitis are two types: chronic hepatitis and acute hepatitis. Here I have discussed about the chronic hepatitis types and their treatment. Chronic hepatitis means long-term infection, liver inflammation, and damage to the liver. Progression of the disease can cause liver cirrhosis, liver failure, or liver cancer. Chronic hepatitis are mainly of three types: hepatitis B, C, and D. Hepatitis B, virus HBV virus, incubation period more than 90 days and less than 160 days. Transmission through contact with infected body fluids. Symptoms: abdomen pain, dark urine, fever, joint pain, vomiting, painless food. Treatment: alpha interferon, pain interferon. Hepatitis C, virus HCV virus, incubation period 2 weeks to 6 months. Transmission through serums, body fluids, blood-to-blood contact from HCV infected mother. Symptoms: tiredness and weakness, joint pain, fever, dark urine, stomach pain. Treatment: direct-acting antiviral drugs. Hepatitis D, virus HCV virus, incubation period 10 weeks. Transmission through blood and body fluids on the occurring already infected with hepatitis B. Treatment: interferon.
Type of hepatitis, acute hepatitis, is mainly a short-term infection in the body. The body can remove the hepatitis virus on its own. In this type of hepatitis, mild symptoms occur in the body. Examples of acute hepatitis are hepatitis A and hepatitis E. Hepatitis A is caused by the HIV virus and has an incubation period of 2 to 6 weeks. It is transmitted through the contaminated food and water. Common symptoms include like flu-like signs, stomach pain, light colored stool, dark urine, loss of appetite, rapid weight loss, and jaundice. There is no specific treatment for hepatitis A. Hepatitis E HIV virus is a viral infection with an incubation period of 2 to 10 weeks. It is primarily transmitted through the fecal-oral route, often via contaminated water or the consumption of uncooked meat. Common symptoms include dark urine, joint pain, loss of appetite, abdominal pain, liver enlargement, acute liver failure, nausea, and vomiting. Currently, there is no specific treatment is available for hepatitis E. Thank you.
Autoimmune hepatitis, for its immune system mistakenly attacks healthy liver cells, causing chronic inflammation. Metabolic disorders are genetic conditions that can lead to liver inflammation and damage. Systemic hepatitis is reduced blood flow to the liver, often due to cellular failure or shock. It can cause liver cell damage. Pancreatic disorders are conditions in the bile ducts or pancreas that can sometimes lead to liver inflammation. In old age, liver breaks down harmful substances, mostly toxins, and their byproducts stay in the gut longer. Frequent consumption of certain medications, potential toxins, industrial chemicals, herbal or dietary supplements can develop liver inflammation and damage the liver, especially in children. Women are more prone to hepatitis than men. Being female seems to metabolize certain toxins more slowly than male. Liver of a female is exposed to higher blood concentrations of harmful substances for a longer time. This increases the risk of toxic hepatitis.
Hepatitis especially, hepatitis C can affect the lungs in several ways. The virus can cause lung problems directly or indirectly. It may lead to lung disease like interstitial pneumonitis, pulmonary fibrosis, and asthma, and worsening conditions like chronic obstructive pulmonary disease or COPD. Many people with these infections may not show any symptom at first, but the disease can slowly get worse. Hepatitis can also lead to other problems such as high blood pressure in lungs, autoimmune disease, and certain type of cancer. Doctors suggest doing pulmonary function test to check lung health in people who is infected in hepatitis.
Effect of hepatitis on heart. Emerging. Effect of hepatitis on heart. Emerging research indicates the potential link with hepatitis B and various heart problems. Studies have explored the virus's effect on the cardiovascular system, revealing association with conditions like increased atherosclerosis risk, potential for heart failure and cardiomyopathy, and impacts on ventricular function. Some research even suggests the link between paternal hepatitis B infection and congenital heart defects in offspring. Myocarditis, pericarditis, palpitation can be the side effects. The mechanisms behind these associations, though not fully understood, may involve inflammation and immune responses triggered by the virus.
The impact of hepatitis on brain. Hepatitis C can indirectly but significantly affect the brain through a condition called hepatic encephalopathy. When the liver is damaged and unable to filter toxins from the blood effectively, these harmful substances such as ammonia can travel to the brain. This buildup of toxin disrupts normal brain functions, leading to a spectrum of neurological
এইচসিভি নির্ণয়ের জন্য দু ধরনের পরীক্ষার প্রয়োজন হয়। এক, সেরোলজিক অ্যাসে, দুই মলিকিউলার অ্যাসে। এইচপিভি সংক্রমণ বিভিন্ন ধরনের ক্রনিক কিডনি ডিজিজের কারণ হতে পারে। গত কয়েক দশকে প্রাপ্তবয়স্কদের মধ্যে এটি কিডনিতে উল্লেখযোগ্য প্রভাব ফেলেছে। হেপাটাইটিস বি এর সাথে যুক্ত সবচেয়ে সাধারণ কিডনি সমস্যাগুলোর মধ্যে রয়েছে গ্লোমেরুলোনেফ্রাইটিস। কিডনির ছোট ফিল্টারগুলোকে ক্ষতি করে। এর মধ্যে মেমব্রানোস্নেফ্রোপ্যাথি এবং মেমব্রানোপ্রলিফারেটিভ গ্লোমেরুলোনেফ্রাইটিস রয়েছে। এতে প্রস্রাবের প্রোটিন এবং কিডনির কার্যকারিতা হ্রাস ইত্যাদি উপসর্গ দেখা যায়। পলিআর্চারাইটিস নোডোসা, এটি একটি বিরল রোগ যেখানে ছোট এবং মাঝারি আকারের ধমনীগুলো প্রদাহিত এবং সংকুচিত হয়। এই ভাইরাস একটি ইমিউন প্রতিক্রিয়া উদ্দীপিত করে যা ইমিউন কমপ্লেক্স তৈরি করে। এই কমপ্লেক্সগুলো গ্লোমেরুলিতে জমা হয়ে প্রদাহ এবং ক্ষতি করে। কিছু ক্ষেত্রে ভাইরাস সরাসরি কিডনির কোষে সংক্রমণ ঘটিয়ে কিডনির ক্ষতিও করতে পারে। ইম্প্যাক্ট অফ হেপাটাইটিস অন রিপ্রোডাক্টিভ সিস্টেম। ম্যান এবং ওম্যান উভয়ের মধ্যে হেপাটাইটিস বি দ্বারা ফার্টিলিটি এবং প্রেগনেন্সির ফলাফল প্রবাহিত হয়। এই ভাইরাসের দীর্ঘমেয়াদী সংক্রমণ পুরুষদের মধ্যে স্পার্ম কোয়ালিটি এবং মর্টালিটি কমাতে পারে এবং নারীদের মধ্যে টিউবাল ইনফার্টিলিটি এবং ইমপ্লান্টেশনের হার কমে যেতে পারে।
In conclusion, hepatitis is more than just a liver disease. It's a serious public health concern that can affect multiple organs, including the lungs, kidneys, heart, and brain, leading to long-term complications if left untreated. Our chart highlights not only the types, symptoms, and prevention strategies, but also sheds light on the global, national, and state scenarios. The rising number of cases and limited awareness make it crucial to spread knowledge, especially among women who often prioritize others' health over their own. By staying informed, getting vaccinated, and promoting safe practices, we can protect ourselves and our communities from the silent threat of hepatitis. Let's take a step forward today for awareness, prevention, and a healthier future. This was Team Spark, and we say no hepatitis. হেপাটাইটিসটা সত্যিকার আমার অতটা জানা ছিল না এই ডিজিজটার ওপরে, কিন্তু এইটা প্রত্যেকে জানা গেছে মানে কতটা ডেঞ্জারাস হেপাটাইটিস ডিজিজটা ডিজিজ মানে পুরো সবকটা টাইপ নিয়ে যদি বলি, এবং এটাকে কিওরও করা যায়। আগে হেপাটাইটিস শুনেছি অনেক সময় কিওর করা যায় না, মরে গেছে হেপাটাইটিস এতজন মরেছে, কিন্তু এটা মানে যদি আমরা প্রপার ট্রিটমেন্ট করি এটা কিওরও করা যায়। মানে ইন্ডিয়াতে এত ভালো ভালো এত চিপে ট্রিটমেন্ট হয়, এটা আমরা জানা গেছে। ভবিষ্যতে যদি কারোর হেপাটাইটিস হয় আমি তাকে লিড করতে পারবো যে এটা করো।
হেপাটাইটিসের বিষয়ে হ্যাঁ সত্যি কিছু জানা ছিল না আগে, কিন্তু এটা ভীষণই ডেঞ্জারাস। মানে শুধুমাত্র যে লিভারটাকেই ড্যামেজ করে তা নয়, সঙ্গে ব্রেন, হার্ট, লাংস, কিডনি এইসবেরও খুব এফেক্টটা ফেলে, যেটা খুবই প্রাণঘাতী, মানুষ মারাও যায় এর থেকে। মানে এই প্রজেক্টটা করার পরে আমি এটাই জানতে পারলাম যে এটার জন্য খুবই কশিয়াস থাকা উচিত। আর এমনও নয় যে সবসময় মারাই যায়, কারণ এই মুহূর্তে অনেক রকমের ট্রিটমেন্টও রয়েছে, যার জন্য এখন যে মারা যাবে এটাই সবসময় প্রথমেই ধরাটা আমাদের উচিত।
হেপাটাইটিস সম্পর্কে যখন আমরা এই ওয়ার্ল্ড ম্যাগাজিনটা বানাচ্ছিলাম তখন হেপাটাইটিস সম্পর্কে যেমন অনেক কিছু জেনেছি, কোথায় আমাদের শরীরে কোথায় কোথায় ইনফেক্ট করে তেমন জেনেছি। আগে শুধু জানতাম শুধু হেপাটাইটিস নামটা জানতাম, বাট হেপাটাইটিসের যে এত টাইপ হয়, প্রত্যেকটা টাইপে বিভিন্ন বিভিন্ন অর্গান ইনফেক্ট করে, তো সেগুলো জানতে পারলাম। প্রত্যেকটার ব্যাপারে এগুলো কিওর করা যায় সেই ব্যাপারেও জানতে পারলাম, তো অনেক কিছু জানতে পেরেছি, খুব ভালো।
জন্ডিসটার জন্য মেনলি জন্ডিসটা হয়ে থাকে, আর এটার জন্য এটাকে প্রিভেন্ট করা যায়। যারা আর কি এক্সেসিভ লেভেলে অ্যালকোহল খায়, এটা একদমই উচিত না খাওয়া। স্মোক করা উচিত না, এগুলো করা উচিত না। এগুলো না খেলে মানে লিমিটে খেলে তাহলে হচ্ছে না যারা আর কি ছাড়তে পারবে না মানে খেতে বলছে, তো তাদের জন্য মানে সেটাকে বলে আর কি বলবো, কীভাবে ওটা হচ্ছে শরীরে ওটাই জানতাম, শুধু লিভারটাই জানতাম, বাট ব্রেন, লাং, কিডনি, হার্টকেও এফেক্ট করে, ইভেন রিপ্রোডাক্টিভ অর্গানকেও এফেক্ট করে, এটা জানতাম না।
হেপাটাইটিসের মানে
আমরা জানতাম যে মানে হেপাটাইটিস শুধু আমাদের লিভারকে ইনফেক্টেড করে, বাট এই ওয়ার্ল্ড ম্যাগাজিনটা বানানোর সূত্রে আমরা জানতে পেরেছি যে হেপাটাইটিস আমাদের ব্রেন, লিভার, কিডনি এবং আমাদের রিপ্রোডাক্টিভ সিস্টেমকেও ইনফেক্টেড করে, এবং অ্যালকোহল বা স্মোকিং মানে একটা গুরুত্বপূর্ণ কারণ হতে পারে হেপাটাইটিস, হ্যাঁ হেপাটাইটিসের ক্ষেত্রে। তো এর ক্ষেত্রে মানে বলবো পরিষ্কার পরিচ্ছন্ন খাবার দাবার, জলগুলো তো
পরিষ্কার থাকতে হবে,
পরিষ্কার থাকতে
সুস্থ
হবে,
জীবন চাই।
পরিষ্কার থাকতে হবে, পরিষ্কার জায়গা থেকে জল পান করতে হবে, এবং মানে ঢাকা দেওয়া, মানে খাবার সবসময় ঢেকে রাখতে হবে যাতে কোনো জীবাণু যাতে এসে মানে ওটাকে ইনফেক্ট
আমাদের সিলেবাসে ওইভাবে হেপাটাইটিসের ব্যাপারে বেশি কিছু ছিল না, কিন্তু আমরা যখন এই ওয়ার্ল্ড ম্যাগাজিনটা বানালাম তখন হেপাটাইটিসের ব্যাপারে অনেক কিছু জানতে পারলাম। আমার বাড়ির একজন খুব ক্লোজ রিলেটিভ হেপাটাইটিসে মারা গেছে, তো এবার হেপাটাইটিসের ব্যাপারে মানে কতটা ডেঞ্জারাস, মানে কতগুলো শুধু আমরা ভাবতাম লিভারে এফেক্ট করে, বাট কিডনি, রিপ্রোডাক্টিভ অর্গ্যান, ব্রেন সব জায়গায় হেপাটাইটিস এফেক্ট করছে। তারপর ওর টাইপস, ক্রনিক, অ্যাকিউট যে টাইপস, তারপরে ওটা কীভাবে ডিটেক্ট করা হয়, সিমটমস, অনেক কিছু জানতে পেরেছি ওয়ার্ল্ড ম্যাগাজিনটা বানাতে গিয়ে।
Part and we say
No hepatitis, no hepatitis.